welcome to Tharaka Foundation's YouTube channel, Supporting the Whole Child. We just wanted to give you a quick disclaimer saying that everything that is found on our YouTube channel is created for informational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something that you have heard or seen on this YouTube channel. Thank you so much, and without further ado, let's begin today's video.
Hello everyone, welcome to the Tharaka Foundation YouTube channel, Supporting the Whole Child. I'm your host, Poonam Nagpal. I do have Dr. Leena Khanzode with me. If you remember, we were talking about anxiety disorders, and during the last episode, Dr. Leena educated us about the generalized anxiety disorder. So today I'm going to ask her if she's going to teach us some more disorders. Dr. Leena?
Thank you, Poonam. Yes, I am going to educate today about a couple other types of anxiety disorders. I thought maybe we could cover separation anxiety disorder, and then there is another one called as social anxiety disorder. So coming to separation anxiety disorder, this is a disorder that we see commonly in younger kids, more so than older kids. It's not that older kids don't have it. Sometimes teens would also show signs of separation anxiety, but it's much more prominent in younger kids. Now, if I take you back to your early days with your kids, Poonam, when they were little toddlers, and maybe if you think of a time when they went to preschool or a daycare and you started working and you had to drop them off the first time, usually the memories are like, oh, those first few days were very hard as a parent, of course, and even for the child, it's hard because the child is separating from their primary, attachment figure, as we say, right? The primary person who's their caregiver, the parents, the mom, particularly, and dad. So that, we see for a few days, and I don't know how much you remember, but as far as I remember with my daughter, I remember it was there for the first 3-4 days. Maybe it stretched for a week. Every drop off would be crying and really like making me feel really guilty about leaving her with somebody. I knew she was in good hands, but it is a difficult thing for the child to get used to and build connections and attachment and trust with other caregivers. So that is normal separation anxiety. The reason I'm bringing that up is that a lot of kids experience that, or pretty much all of the kids experience that, and that's fine. But when it goes on and on for weeks together, and if the child is, uncomfortable to separate from their parents and not warming up to the new environment, or even otherwise, like if they are home, they may have a nanny at home, but parents, have to step out for some either running errands or some social engagement, and the child creates a very big, fuss around that. When they are separating from their parents, essentially is when they start to cry and really have a big reaction. And so that can be a telltale sign of like, oh, this is a little bit more than normal separation anxiety. And again, it has to be both, right, in intensity and in duration. So we definitely don't want to like overdiagnose, and I don't want to worry the parents who are watching our show to feel like, oh my gosh, my child has separation anxiety disorder already. It's not that, we jump to that if you see it for a few times. But, along with that, if you're seeing the child is having, trouble sleeping when parents are not around them, or having bad dreams about something bad happening to the parent. A common thing a lot of kids experiences whenever parents are stepping out or parent is traveling for work, they may have really very serious worries about something bad happening to their parent, or something bad happening to them if the parent is not around. So a lot of the times it just builds upon it. So it's not just like I want to be with my comfort attachment figure, but it's more than that. It's like I definitely want to be is one thing, but if I'm not with them, I think of 10 different things that can go wrong. And I am very distressed by the fact that my parent is not around me or my primary caregiver is not around me. So those are some of the things some kids experience, and we do see that a few times, particularly more younger age population presents with that. And so the focus is to actually, work through that, and it is something we can find a way to work with it.
Actually, Lena, you did bring those old memories with me. To be honest, more than my daughter, I was more anxious when I was putting her to the child care when she was 2.5 months old. So it was very hard on me. I think I had that separation anxiety myself, thinking, is she in good hands? Will she drink enough? Will she eat enough? But you're right. Over the time, I did get used to it, and I had to think like, she's in the safe place, and I'm doing my job. It is needed. But talk about like child separation anxiety. Even my daughter, I felt she was fine when she was a baby, but she did throw tantrums when she came to know like this is going to be her routine, and then she would suck her thumb more. I do not know how babies they pacify themselves. So anything like you are saying, it is treatable. So what can parents do to minimize that social anxiety or separation anxiety among teens or kids?
So, I want to also add that, we do see separation anxiety in adults too. So, since we are talking more about children and teens, I'm focusing more on that. But, we've had also parents who are more, like you said, anxious when separating from their child. So the ways one can, I guess, maybe prevent and as well as work through that. So it's a very natural process, like I said, right? Because your primary caregiver is not with you. For a child in the first few years, particularly in the first 2 to 3 years, it's a very important kind of developmental growth that happens in terms of building that attachment and trust with the primary caregiver. So it's a very important milestone for emotional social development. And so, you know, usually if you have spent a good amount of time bonding with your child, and I know the maternity leave doesn't do justice, or paternity leave don't do as much justice to how much time you can spend with your child. But people tend to take anywhere from 2 to 6 months using their FMLA leave sometimes. But despite of that, I mean, when you're going out to work, at the end of the day, you're coming home and you are attaching back with your child and giving them that sense of security and giving them that sense of predictability and certainty that if we go, we separate, but we always come back and we meet. And so that is very important thing to do. And then I always tell this to parents, even though there's tiny infants, they don't have a way to talk and they don't have a way to, we think, understand. They do understand. They are absorbing a lot by watching what's going on around them. So if you are as a parent anxious, those vibrations or those behaviors of yours are picked up even by a little infant. It doesn't need to be that the child has to be 5 years or older or whatnot to be able to detect that. So they are very sensitive to that. So one thing is to learn to calm your own anxiety and reassure yourself that you've picked the right caregiver for them, that you are going to meet them at the end of the day, that you are their parent, you will spend more time with them on weeknights and weekends. So managing your anxiety is a key thing, because a lot of the times it's a two-way process. The parent is very anxious, and because the child is crying each time, that triggers a lot of worry and guilt in the parent, and then that cycle just keeps continuing. So that's kind of, in a way, one way to maybe prevent from making it bigger, because normal process will happen, but not letting it go on and become more intense and longer. The other thing that we do once you have developed a little bit of separation anxiety and you're feeling like, I'm getting constant calls from the daycare. I need to pick up the child. They are just not eating. They're not thriving there. And it's become a functional issue for the child that they are not able to function. They're not, thriving, in other words. Then, we do what we call as a gradual exposure therapy. So there is this term that we call as gradual desensitization. So, because this is a new phenomenon, it's a new change for the child, suddenly changing routine from going from one place to another place and being with our other caregivers, other kids. So sometimes, maybe they are not ready for that whole big change all at once, that they cannot be there for a whole day to begin with. Some kids do fine, some kids need a little bit more of a tailored approach. So gradual transitions could help. So you start with putting them in the daycare for part-time hours initially, and then slowly increase that. And then, that could be like, you're exposing them to that fearful stimulus, but you are also kind of modulating that. So there is that one aspect to that. The other aspect is also to give them reassurance from the providers they are with. So of course, most daycare caregivers are trained to calm them and soothe them and distract them. So those are the strategies we use. So even if the child is crying for a few minutes, don't worry and don't overreact and panic. Let them, express some of those emotions. And then, at the same time, you are building this new trust with the child and you are building this new relationship. So we call it like you're gradually desensitizing them from this new stimulus, this new environment, and that's kind of a way to overcome it.
Okay, it is now making sense to me, Dr. Leena. Instead of, just putting 5 days in a week straight for 8 hours, maybe do it part-time, few days, or maybe few hours in per day, right? So that they are getting used to it, you are getting used to it, you are not anxious. And as you said, it was a very deep concept what you shared. If parent is anxious, that energy is going to a child. So if parent is calm, child will be calm. And and then depart with that smiling face, talking to baby. Yes, mommy is going to work. I will come back. We will have good time together in the evening. Said, they need to be desensitized slowly and develop that routine. Then they will be adaptable to the bigger change. That's good to know. So I wanted to ask you another question, Dr. Leena. You talked about travel. Sometimes we working parents, we do need to travel. And maybe that is the time when there is a more anxiety. So how do we tackle that kind of situation?
So again, it is really working with your child and educating them that, this is part of what you do. That does not mean you don't love them, that you don't care about them. Telling them that this is, something you have to go for, but there is going to be another caregiver who's going to attend to them and care for them. And that you will also be calling them, you will be doing video chat, finding ways to problem solve, as we say, ahead of time before you're entering the problem. So, giving predictability and certainty about certain things, letting child know what's coming, giving them a heads up, finding a way to problem solve. If this happens, what can mommy or daddy do? Those are the things that can really help the child to feel reassured, and they can, feel like, okay, we have a plan B, we have a plan in place that, yeah, mom has to go, but dad's going to be here, and my grandma is going to be here, or the nanny is going to come, and my routine is going to be consistent. So that's another key. So when parents travel, it's still important for the other caregiver to make sure their routine is consistent, because that disruption can trigger more anxiety. So keeping the routine consistent, giving them enough heads up, staying in touch with them, giving them reassurance about any kind of worries they have. Now, again, this seeking reassurance is a very common thing that kids like or want when they are anxious. So we actually look at this as a very kind of two-edged sword in a way. Like so in one way, seeking reassurance and giving them reassurance helps them to calm down, but that shouldn't be a strategy all the time, because what we also learn that is that if you're constantly reassuring your child, they're constantly looking for it. You are kind of reinforcing that wrong behavior of seeking reassurance, and they may continue to need that for every little thing. Because, at that younger age, especially in the first 10 years, I say you are doing this molding of their personality, shaping them for the person they are going to be, shaping their behaviors. So everything you do is going to shape that. So, a lot of the times I see parents kind of getting to this other end of like reassuring, which then becomes like this habit for the child. For everything they want that assurance, and then it becomes exhausting for parents to keep up with that. So reassurance in a sense of what are the facts, what are the things to expect, what are the things that will be in place if things were to come up, those types of reassurance. So you're always thinking with them, you're allowing them to think and not just providing an answer and let them kind of feel like, oh yeah, my problem is solved. So so that is an important thing, to really do it in the right way. So yes, you can reassure that yes, mommy will call you at every day after the meetings are done, but you can call me every time you're worried, and our mommy will pick up the phone and call you. Yeah, I'll call you every hour between my meetings. Those types of things, just to make them feel comfortable because they're asking for it, you shouldn't do that, because then you are giving them a wrong message. They are expecting that, and then if you don't do it, that triggers anxiety for them, right? So we want them to reason logically. You're slowly helping them think a little bit more logically about, okay, so what do you think will happen if I go for this meeting, if I leave out of town? Oh, I'm worried about you flying, and maybe your plane will crash. Maybe the child says that, and so you can sit down with them, and instead of saying, no, it won't crash, it is not something that has happened, so it's not going to happen, and like cutting that there, maybe taking a few minutes to sit down with your child and saying, okay, let's look at what makes you think this way. How often do crashes happen? Let's like maybe even look at the statistics of how many flights take off every day in the world, or even from our city, and how many times do you hear in the news that the plane has crashed? So you're kind of giving them this reasoning. What's the probability of something like this to happen? Because what anxiety does, it makes a mole look like a mountain, like they say, right? So to a child, it might seem like, even though they may have heard of, oh, planes can crash, or one of the news, they may think this happens every time or to everyone. So your job is to not just, it's not going to happen and just pack it there, but sit down and give them tools to reason, to build their logical reasoning. And that's the way to reassure them, not just like saying something and covering it up.
Thank you, Dr. Lina. I wish I knew all that when my kids were young. I did not travel at all for my work, and I was very clear, I do not want to travel. I took a job which did not require me to travel. But very practical advice, as you said, don't overdo it. Even make your child part of the conversation, educate them. This is the time frame. Mommy is going to be away. Daddy's there to take care, and I am always there. If you are feeling something, my phone is there, right? And then, as you said, even that caretaker, if the same caretaker is taking care and their routine is not disrupted, they can handle it very easily. Yeah, that's
Yes.
wonderful advice for working parents. So anything else, Dr. Lina, you would like to tell us before we end today's session?
So I was hoping to cover social anxiety disorder also a little bit. So I'll maybe start a conversation about it, and in our next episode we can talk a bit more about it. So social anxiety disorder is kind of a type of anxiety that people experience in social situations, like the name says. So a lot of us are shy and introvert, and so we may feel anxious when we are in a big group of meeting with colleagues or in a party. And this happens universally to all of us, right? So kids experience this, teens experience this, adults experience this, and so there is, again, it's kind of, again, we are talking about how much is normal, So like I said, it's a normal emotion. Separation anxiety is normal. Generalized little worrying, that is normal. Social anxiety, similarly, is normal if it's in that 1 to 5 range, arbitrarily, if we kind of take that scale of 1 to 10 again. But when it starts to affect my day to day life, because of the social anxiety, I'm now starting to avoid going to events. I'm avoiding work meetings. I am missing school because I'm anxious to be on the Zoom camera, things like that. I'm talking about the current online education that has also generated a social anxiety for some kids. So that can be a thing to be aware of and be paying close attention to. Is this moving in that disorder range? So, usually social anxiety can progress where people can like start to isolate and really not socialize with their peer or with big group of people. A lot of the times in kids, we see they are comfortable around adults, but only when they come around their peer, the anxiety is what they feel. So that's an important thing to notice. Like, is it happening a lot in every peer group, or is it just like more of a bigger peer group? Are they more comfortable with 1 or 2 friends? So you can, of course, modulate that, and it's not a bad thing if they are more of like, content with 1 or 2 friends and they don't like to be in big birthday parties or whatnot. But generally, still keeping an eye on how that's shaping, how much is that impacting their day to day life? Are they missing, social connections because of that? Are they missing school and academic, progress because of that? That's when it starts to become a concern. And so, we will delve into how to work through that and treat that in the next episode. I will end there, and I don't know, Poonam, you have any questions about that?
I was thinking about this social anxiety. I do remember kids, they do hide behind their parents when, parents are taking them to a big gathering. Maybe that is also part of that social anxiety. They are in the new environment, they're not comfortable yet. And maybe, if they attend too many, they will become comfortable. But as you said, it's okay, normal. But if it is going to impact their interaction or their school, then parents need to be more watchful. So thank you, Dr. Nina, for educating us on the 2 new disorders. We talked about separation anxiety, and we just started about social anxiety. So I'm looking forward to learn more from you during the next episode. Thank you so much for joining us today.
Thank you.